Welcome back. Have you got the jab? Have you got vaccinated? Are you encouraging people to go out there, register on the CoWIN platform and get vaccinated, or just walk into a center and get vaccinated? Do that. Join us here at Sanjeevani. Well, let's try and take a look at the daily caseload in our country and whereabouts we are. There was a bit of a surge, which is a cause for worry, but it seems to be tapering down. Overall, it's a plateau around 35 to 38,000 cases. July 17th, it was about 38,079 cases. This whole week, it went up to 41,000, then came back to 38,000, then slipped about 30,000 cases on the 20th of July, then went up to 42,000, 41,000, and then finally on the 23rd, that's today, the caseload is around 35,342. So overall, somewhere around 35,000 is the average, but we need to bring this down. Even in our country, 35,000 is a matter or a cause for worry. Then the other aspect that stands out is the third wave threat. Now, is there a third wave in sight? That's what. So this dip and move up. So 4,24,025 cases, active cases, went up to 4,22,000, went down to 4,22,000. So minus 6,000 down, then minus 1,300 down, then 995 down, 15,000 cases down. That was the big dip that happened. And then as in terms of the active cases that came through, then it went up by 1,000 cases, gone up by 2,200 cases, and now it's once again slipped by 3,881 cases. So there are bubbles and there are certain ripples which are happening, but so far we seem to have kept the threat of a third wave in check at this point, somewhere on the 23rd of July. But we need to do this consistently, and as more and more people get vaccinated, the lesser the chance of it having the kind of impact that we saw in the second wave. Plus there is a certain level of preparedness also which is visible on ground across states and across districts. There are some states which are a cause for worry, but that is what it looks like as an increasing trend. Going across to Dr. Suresh Ramasubban, who is Senior Consultant Pulmonary and Critical Care Medicine at the Apollo Multi-Speciality Hospitals in Kolkata. Dr. Suresh, namaste. Thank you very, very much. Let me ask you this. Do you see a third wave or do you see ripples and bubbles? What's the situation in Kolkata itself?
Kolkata is actually pretty nice right now. I think, as you rightly mentioned, the cases have really come down. As I always like to mention, even if all these projections and numbers from various things are wrong, hospitalization rate is a very good indicator of how things are going. And right now, hospitalization rates are just down to about 19 patients in inpatients from a peak of 410. So you can obviously tell that it's really slid down. The lowest we had was 11 in March of 22nd, and then it started trickling up. Yes, the third wave is going to, should happen or would happen is what is the prediction, because of the fact that we still have only about 6.4% of our population who's got 2 doses of vaccine left. So most of the projections, though I'm not a public health expert, but most of the projections would look at end of August and beginning of September as the potential. So we cannot let our guards down. We need to get most of the people, at least the second jabbers and first jabbers. The numbers have to really go up to prevent that from happening.
I totally agree with you. We need to get up to 60 to 65 crore plus out of a base of 95 crore people by the end of August itself. And by then you will also see a lot of people in August and September who will be due for their second shot, because they would have all completed that 80-day, 84-day period if they've got the jabs in March and April. So then they would come in August, September, October, November. These are the 3-4 months where the second shot takers will also come. But even if you've got one jab, does that not, is it not important? What is your understanding as a medical professional saying, does that bring the morbidity or the mortality down?
So there's a very wonderful study out in the US looking at 4,000 frontline workers who were vaccinated, who had a RT-PCR done every week of their work while during their epidemic going on, and people who had, so if you look at per 1,000 person days, the exposure if you have two doses of vaccine is 0.04. It's about per 1,000 person days, and it's about 1.9 if it is 0.19 if it is one vaccine only, and 1.34 if it is no vaccination. So there's obviously a slight increase. You still have a definite protection with the first 1 dose of vaccine, but it's not comparable to what you have if you have 2 doses. And this is especially true for the Covishield kind of vaccine, adenovirus vector-based vaccine, which probably requires a second dose to get it into efficacy. But the data, as I said, the difference is, as I said, number per 1,000 person days is not that significantly different as compared to if you don't get vaccinated at all. So one shot is better than no shots, and 2 shots are the way to go.
Is the way get go. So let's just hope that count comes back, and as soon as you're due for your second shot, go ahead and get the second shot. And those who have not yet gotten vaccinated, please go ahead and get yourself vaccinated. More and more vaccines will be available in the market very soon. Already we've got 3 options. We should get into 4 and 5 by the time we get towards mid-August, end August. That's what the indications suggest. Doctor, thank you very much, Dr. Suresh. Always a pleasure speaking to people from the medical fraternity. Great job done to you and to your peers, and keep up the good work in keeping India safe and healthy. Thank you very, very much. Here's a quick check on where the Sanjeevani Gadi is up and about today. 5 states, 5 districts, 500 villages. That's the aim. Today, the Sanjeevani Gadi is in Nashik, active in Nashik and in the region of Guntur. 2 villages in Nashik, 2 villages in Guntur. So far, about 446 villages have been covered. Close to about 2,25,000 people have also been reached across these villages, and they have been encouraged to go ahead and get the vaccine. आपने टीका लगाया क्या?
आपने टीका लगाया क्या?
टीका लगा, ओ जरा टीका लगा। जब अपनी बारी आए टीका लगा। टीका लगा, ओ जरा टीका लगा। जब अपनी बारी आए टीका लगा। टीका लगा, ओ जरा टीका लगा। ओ जरा टीका 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 लगाया क्या? लगवा ले जुबान जरा सहले सहले, तू सबसे ये कह ले है जन ही तुम्हें जाने मिलती का डरना, ओ निडर। टीका लगा, ओ जरा टीका लगा। जब अपनी बारी आए टीका लगा। टीका लगा, ओ जरा टीका लगा। ओ जरा टीका 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 लगाया क्या? लगा, ओ जरा टीका लगा। जब अपनी बारी आए टीका लगा।
Now, are sanitizers harmful? Do vaccines modify your DNA? Can they infect you with COVID? Are these some of the questions which you have in your mind? Well, now there's a space where you can get all your queries answered, and that too on your phone as part of Network 18 and Federal Bank's campaign. WhatsApp helpline has been launched. All you have to do is WhatsApp on the number 7977773753, and you'll promptly receive your answers.
टीका लगा, ओ जरा टीका लगा।